earlier this spring, we had a lot of difficulty getting information from the state concerning the number of cases we had and who they were affecting. So at that time, the task force and EMA directly went to the school districts. We met several months ago with all the superintendents of the school districts, and that time we started to draw up plans of how to address the probable upcoming outbreak and how we would deal with it as a group, and had a great meeting and decided we would keep in contact on a daily basis with EMA and myself concerning all the cases that were probably going to happen in the future. Then approximately 1 or 2 months ago, I was contacted by an official from the state concerning immunization of students. And at that time, the state said they were probably unable to develop a program to immunize the students, and asked for our cooperation in setting up a plan for mass immunizations of the students of Lebanon County. And 1 or 2 weeks ago, we met as superintendents, EMA, and the task force, and decided we would undertake that task. And at this point, I'm happy to say that all school districts are on board. Just a couple things I should say. We're seeing cases already. All school districts at this point have recorded influenza positive individuals. The recommendations for people out in the county, these people should not return to school until they're temperature free for 24 hours without any Tylenol or such medications. So at this time, I can't tell you any specifics. We will hopefully, if vaccine is available to us, we hopefully will do it in December. We will probably take a Saturday in 2 weekends in December and immunize the students of Lebanon County. We will, at this point, we hope to have 2 sites, one on the eastern end of the county and one on the western end of the county. And like I say, targeted groups for H1N1 are pregnant women, household contacts of children under 6, and persons 6 months to 24 years, adults under 65 with medical conditions, and first responders. So they should stay home until that happens and not return to school. And of course, obviously, the proper precautions, proper hand washing, and protecting from spreading the droplet from coughing by coughing into your elbow or sneezing into your elbow. And you've been seeing this in newspapers and articles throughout.
The way the DOH template is set up, we need approximately 70 to 100 people to actually support these vaccination centers. That's a different approach in that our agency, our office, is going to be the point of storage for all of the vaccine and the syringes and peripheral equipment. That allows us to take it out on site as it's needed in different locations within the community based upon the manpower and the support that we have. We'll be storing that downstairs and distributing it as it.
What if the school children don't want it? I mean, what if the parents of the school children do not want them vaccinated?
This is strictly a voluntary program. Nobody has.
This week, letters went out to all parents in all the school districts, advising them of what we're having planned, and to a questionnaire saying how many people were interested to see how many people we're going to be dealing with, and so they've all been notified.
I think our plan is just to make sure that we have enough vaccine for everybody that wants it, okay? But we're not going to force anybody to get vaccinated. It'll be strictly voluntary, and there will be no charge for this. The public vaccination centers will be set up and manned by volunteers, and like I said, there's no cost associated with it for the public. So you can still go to your personal physician if you want, and you can still get your vaccination, through your personal doctor if you choose. But many people don't have medical care. Many people can't maybe afford to go to a doctor. Getting huge.
That you're going to have trouble recruiting 70 qualified nurses. And I was talking in a meeting this morning with the head of the VA, and he's willing to recruit volunteers, so I pass that on for your information.
Sure.
We're reaching out to almost anybody we can reach out to. I received a list of the veterans organizations this morning from our Veterans Affairs. We're going to be reaching out to those people. We're reaching out to the medical community and the community at large. We're in need of both medical and non-medical people to help. Anyone who is interested in volunteering can contact our office. Phone number is 272-7621, or they can go onto the Pennsylvania Department of Health's website or Serve PA and register that way.
And that information.
Lebanon Catholic.
What we've been encouraging the schools to do is to register themselves as a mass vaccination center, okay? Giving the total, their school population, whatever number of units of vaccine that they would need, and use our office as a mailing address for that vaccine.
If the schools are experiencing the problems en masse now, why are we waiting till December to implement this action?
Well, number one, the H1N1 virus will probably go through till spring. It'll be come in waves. You know, we're seeing a small wave now, we'll be getting more waves until spring. Number one, the state will not tell us when we're gonna get the vaccine. So we can't even begin to talk about a date until the state lets us know when we're gonna be getting the vaccines.
But if you would get it early, you would move the date up?
We could, yes, absolutely.
Yeah.
Responders, the EMS people, okay, are supposed to be in their first line of to be vaccinated. There's a plan by the Department of Health right now, and I believe tentatively it's at the Belle Grove Fire Company to take care of our ambulance people, our ALM.
I sat through the pandemic task force meeting that you had a couple of years ago, and quite frankly, if you get a lot of serious cases, the hospitals around the region do not have the capacity in their critical care units to handle that, and they were talking about people dying at home.
Go to the hospital because you're sick, and you got a waiting room full of people there that are infected with the flu. If you didn't have it when you went in, you're gonna have it when you come home. So it's important for people to be able to take care of themselves at home. You know, they should have some basic knowledge and basic supplies and be able to sustain themselves at home unless they develop a serious medical problem that requires them to go to the hospital with the doctor. Okay.
And it's not a local problem. This is a national issue as far as availability of vaccine and those things.
Caveat is that people that are allergic to eggs, because it's an egg-based vaccine, so they don't normally give it to people that are allergic to eggs.
We have to take into account traffic flow patterns, the ability to accommodate a large number of people or a smaller number of people depending on the response. Security for that, the number of medical personnel required, okay, to actually administer the vaccine, volunteers to take patient histories and complete paperwork or help people complete the paperwork prior to that. There's, I'm guessing, going to be a surveillance period of time after you get the inoculation, where we're going to have some medical personnel or ambulance personnel on site to make sure there's no adverse reactions. So all of those things are planned. We've got them compartmentalized.
The doses come in like individual doses, or is it a bottle of stuff, and once it's open, does it have to be refrigerated, and are we prepared to store it after it's open?
I'm told that it's being shipped in all three different forms. Probably most of the nasal vaccine has been used up already, but we may get some of that. What we're looking at probably are pre-packaged syringes, but we may get it in some bulk form too, which is why I've made the determination that we'll keep it and secure it, you know, in our location, so I can control the quality and the temperature and stuff in case we end up in that situation.
And we're prepared to control the temperature?
Yes,
Yeah.
we've actually had a donation from a local restaurant supply company. They should be delivering a couple commercial coolers that we can use. We'll put them in our office and secure them. And then, like I said, we'll see that vaccine gets to the distribution center as it's needed.
Okay, thank you.
More for the community, you think?
According to the way the Department of Health came up with their numbers, there's an estimated 130,000 residents in Lebanon County. They deducted from that number the number of school students in Lebanon County, took the remaining number by 30% and came up with people in Lebanon County they feel will, the percentage that they came up with that they believe will be vaccinated is like 29,615. to that.
Yeah, it's
What makes the people over 65 the least at risk?
I don't know, I guess we had more exposures over the years, so, you know, we have a little more immunity than the others.